Good afternoon, everybody. Welcome to the GAUC seminar being hosted by the Vecha Center for Climate Change IISc, which delves into environmental sustainability, a transdisciplinary perspective. At the outset, I would like to introduce that the GAUC is an alliance with the aim of strengthening collaboration among universities and outreach to society on addressing climate issues with the mission to advance climate change solutions through research, education, and public outreach. Other than that, it also aims to partner with industry, non-profit, and government organizations to promote rapid implementation from global to local scales. At this point, I would also need to introduce the Vecha Center for Climate Change based at the IISc, which is dedicated to advancing climate science, fostering sustainable practices, and catalyzing policy interventions. In line with this, I extend a warm welcome to all of you for this upcoming seminar. During this event, we'll be showcasing contributions from emerging researchers at DCC, focusing on the domains of agriculture, hazards, and health in the context of a changing climate, scheduled as part of the Global Youth Climate Week. A small detail about myself: I am the moderator of this seminar. I am an INSPIRE faculty at the Vecha Center for Climate Change IISc. I am engaged in teaching, outreach, and research regarding the impact of climate change on weather extremes such as lightning and thunderstorms. And I am open to collaborations and working on suggestions and queries regarding this seminar, which you can always reach me at my mail address. Going to the schedule of this seminar, there will be 3 talks. The first one will be delivered by Dr. Joshitha, who will delve into the interdisciplinary framework of planetary health. Next, in the second talk, Suman will emphasize the importance of sustainable agricultural practices as a solution for addressing the impacts of climate change on agriculture. And finally, Jency will exhibit the evolving patterns of dry and humid heat stress and the impacts on mortality. So coming to our first speaker, we have among us Dr. Joshitha, who is a consultant in climate change and health at the Vecha Center. In this capacity, she has been conducting impactful training programs and workshops for health professionals on the intricate connections between climate change and health. She has earned her bachelor's in dentistry before going on to pursue her master's, and she has also been a prestigious exchange student. So we now welcome Dr. Joshitha on the stage.
Okay. Thank you, Rohit, for the kind introduction. So, greetings, everyone. I'm Dr. Joshitha S, and today I'll be talking about planetary health, bridging concepts and perspectives through the planetary health lens. So, in my presentation, I'll be talking about the shared concepts, which are in alignment with the planetary health. Then, what is planetary health? Then, about our planet, our health, and the need for a great transition. So coming to the concepts with a shared focus. So several holistic approaches exist to safeguard health, and three of the most influential concepts at the moment are planetary health, One Health, and Eco Health. So before I delve into what exactly planetary health is, I'll be touching upon the other three concepts which exist. So first, we have public health. Public health refers to all organized measures to prevent disease, promote health, and prolong life among the population as a whole. And then we have global health, which is the health of the population in the worldwide context. So it's been defined as the area of study, research, and practice that places a priority on improving health and achieving equity in health for all the people worldwide. Finally, we have One Health, which is an integrated unifying approach to balance and optimize the health of the people, animals, and the environment. Now, coming to what is planetary health? So, planetary health is the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention to the human systems, political, economic, and social that shape the future of humanity and the Earth's natural systems that define the safe environmental limits within which humanity can flourish. So, put simply, planetary health is the health of human systems and the state of natural systems on which it depends. Now, how is planetary health different? So it is a solutions-oriented, transdisciplinary field and social movement focused on analyzing and addressing the impacts of human disruptions to the Earth's natural systems on human health and all life on Earth. Now, why do we need planetary health? Why is it important? So we need to realize that now we are in a new geological era, the Anthropocene, which is characterized by humanity's dramatic impact on the Earth's biophysical conditions. So now the stability of the planet's life support systems has sharply declined, putting public health and developmental gains at risk. So by harming our natural systems, we harm ourselves and the future generation. Planetary health maintains a sharp focus on human health while blurring the boundaries between humans and all the life on which we share this planet with. Coming to the future health of the planet. So the future health of the planet and human health are very strongly intertwined. Everything is connected. So changing our planet's natural systems comes back to affect us and not in ways that we would expect. So we need to understand and act upon these challenges. And this calls for massive collaboration across disciplinary and national boundaries to safeguard our health. I agree with the statement by the Lancet, which said there is no public health without planetary health. Now, this is how our environment is changing. So we are seeing water scarcity, the changing food systems, rapid urbanization, the biodiversity shifts, the increased natural disasters, changing land use and land cover, the global pollution, and also the changing biogeochemical flows. All these are having an impact on our health. So these impacts include, but are not limited to, non-communicable diseases, infectious diseases, mental health, nutrition, civil strife, and displacement. Now, going on to planetary health as a new scientific lens. So in the previous slides, you've seen that we have the underlying drivers, the ecological drivers, the proximate causes, the modifying factors, and the health effects. So you can see that all these drivers are leading to the health effects, which were said in the previous slide. So the way we can address this is by focusing on the modifying factors. We need to know that the vulnerability of a community is defined by the characteristics of that particular community. So let's say, for example, we have a community with high societal values, good governance, very strong health systems, and a good socioeconomic status. So these are the communities that can literally build a seawall in case of a sea level rise. And these are also the communities which can, afford an air conditioner during extreme heat. So what happens to those who cannot? So that is where modifying factors come into play. And by addressing these, we can actually help support the vulnerable population to the climate risks. So we are in an ecological paradox. So you can see that the state of human health and that of our planet's natural systems have been trending in the opposite directions. So we have been borrowing against the health of future generations to realize the economic and developmental gains in the present. So we can also see planetary health as a frame for the sustainable developmental goals. It's about understanding that the health of the people and the environment and the planet are all connected. Like when we take care of our planet's health, it sets the stage for achieving the goals we've set for a better world. So by considering planetary health in our efforts, we're essentially making sure that the foundation for achieving the SDGs is strong and sustainable, leading to a healthier and happier future for everyone. I would also like to touch upon the SDG wedding cake by the Stockholm Resilience Center. So there's a short video before I go on to the description. So if you can see here, the foundation layer of the SDG wedding cake is represented by the biosphere, symbolizing the crucial role of a healthy environment and biodiversity in supporting and sustaining all the SDGs. Now, from the great acceleration, we need a great transition. So achieving planetary health requires learning to do nearly everything differently, such as how we produce and consume food, manufacture products and energy, how we construct and live in our cities, how we manage the natural landscapes and resources, and finally, the stories we tell ourselves about our place in the world, our relationship to nature, and what it means to live a good life. So many of our best efforts today may remain siloed, fragmented, and rebellious, but it'll take all of us. We need the policymakers, the storytellers, the researchers, the doctors, the nurses, mainly the youth. So we all need to come together for achieving great well-being for both ourselves as well as our planet. With this, I would like to conclude my presentation. Thank you. Thank you for the opportunity. Over to Rohit.